Qi has four main pathologies, which are deficiency, to rebel, to sink or stagnate. Qi deficiency and Qi stagnation are common in clinical practice. Qi deficiency can be due to a number of factors, including a weak constitution where the building blocks of Qi are not able to assist in the production of Qi, a poor diet affecting the quality and quantity of Qi, overwork causing Qi to become depleted and not be replenished, old age where the natural decline in kidney essence starts to affect the production of Qi. As emotions are also a form of Qi, strong or long-standing emotions such as sadness and grief can tie up and deplete Qi. The main signs and symptoms of Qi deficiency are tiredness and breathlessness, spontaneous sweating which is related to Wei Qi not being able to regulate the opening and closing of the pores, loose stools which typically indicate a deficiency of spleen Qi, palpitations if there is heart Qi deficiency, frequent urination if kidney or bladder Qi is weak or deficient. The tongue may become paler to indicate a deficiency and may also become swollen if there is spleen Qi deficiency. The swollen tongue also shows that the transformation and transporting function of the spleen has become affected. The pulse takes on an empty quality as there is not enough Qi to keep the pulse strong. Qi deficiency can affect any of the Zangfu, but typically shows up in the spleen, lung, kidney and heart pathologies. Rebellious Qi typically affects the stomach, where it may manifest as nausea or vomiting, or in the lungs, where it may present as shortness of breath or coughing. It is mainly caused by either an internal or external pathogenic factor. For example, rebellious stomach Qi could be due to eating cold ice cream too quickly, and this has led to vomiting. We would then say that the rebellious stomach Qi was caused by a cold external pathogenic factor. Qi sinking mainly results in a bearing down sensation or a prolapse of an organ. It mostly affects the spleen. For example, hemorrhoids are one sign of spleen Qi sinking, but can also affect the uterus. Stagnation of Qi usually affects the liver, although a physical injury such as a muscle tear can also cause Qi to stagnate. Anger, which is the emotion attached to the liver, can also cause Qi to stagnate if it becomes excessive or chronic. The typical symptoms of Qi stagnation are pain that moves. The nature of Qi is to be constantly moving, so whilst the Qi is constrained due to the stagnation, it will still try and move as much as it can. Depression due to emotions, which are also a form of Qi, can also become stagnant. Distension due to Qi building up as it stagnates. Heat caused by the Qi trying to move freely but being tightly constrained due to the stagnation. And the tongue may take on a purple colour and the pulse become wiry.